From the Weston A. Price Foundation, welcome to the Wise Traditions podcast for wise traditions in food, farming, and the healing arts. We are your source for scientific knowledge and traditional wisdom to help you achieve optimal health. And now here is our host and producer, Hilda Labrada Gore.
Hey, Hilda here. How can we avoid angina, clogged arteries, and the need for bypass surgery? You would expect a cardiologist to tell you to avoid fatty foods or to take cholesterol-lowering drugs. Not today. This is episode 516, and our guest today is Dr. Jack Wolfson, a self-described natural cardiologist. Jack today offers us his unconventional advice for a healthy heart. And his advice includes identifying the role of mold on your heart, reducing the effect of microplastics in your food, and lowering chronic stress. Instead of the usual things we would expect, like cholesterol-lowering medications, Jack challenges us to build a healthy gut, improve our diet, get plenty of sunshine, movement, and sleep. He also shares some surprising information about the power of fermented foods for reducing the effect of plastics in your food. Fascinating, right? Before we get into the conversation, I want to invite you to become a member of the Weston A. Price Foundation. Did you know that all of our initiatives are member-supported? We are a member-supported organization. And in honor of this, our 25th year, if you become a member this year, you will be entered into a drawing to win a prize from some of our favorite Wise Traditions-friendly companies. So join now. Just go to westonaprice.org and click on the Join Now button and become a member. Use the code POD10 and you get $10 off. It's only $30 a year, and you are joining hands with us in our efforts for education, research, and activism. Thank you so much once again for becoming a member of the family. This is Hilda Labrada Gore, and you're listening to Wise Traditions. Welcome to Wise Traditions, Jack.
Thank you so much, Hilda. Pleasure to be on. Big fan of Weston A. Price and, of course, Sally Fallon and the whole group. So my pleasure to be here. Thank you.
You are our kind of cardiologist, because I've heard you say pharma should not be the first option. It should be the last.
Yeah, most certainly. Listen, there's a time and a place for modern medicine, emergencies, and traumas. But when it comes to the prevention, treatment, and reversal of chronic diseases like high blood pressure, diabetes, obesity, and really everything else, the medical community doesn't have anything. The pharmaceuticals are not the answer there. The answer is root cause medicine, and that's what I talk about all the time.
Well, it's interesting that you mentioned prevention, because I don't know if you know this, but I was born with a birth defect, a ventricular septal defect, a hole in my heart between the lower two ventricles. And I had open heart surgery when I was 9. And I still don't know to this day, actually, exactly what caused it. But I wonder if there's something my parents could have done to prevent that.
Yeah, there certainly is. Everything has a cause. We're not born to have ventricular septal defects. We're not born to have any illness. We are born perfectly. I believe we are created perfectly by God. Our genetics are perfect until something in the environment screws it up, if you will. And I view everything through deficiencies and excess. Deficiencies of the good stuff, which is everything, of course, Weston A. Price talked about, and the the excesses of the bad stuff. And this is where environmental toxins and pollutants can come in, of which there are tens of thousands, if not hundreds or millions of environmental chemicals, man-made poisons. I'm blaming the men on this one. The men are typically the ones who created all the poison. So you're correct. So, and we're not blaming anybody. We're not blaming mom or dad or anybody else. It's all about how can we teach people moving forward. So if you're pregnant out there, if you're thinking about getting pregnant, if you're the mother or father of a person in that category, then we want to, again, share this kind of message. So we don't have a child with a ventricular septal defect, or we don't have a child with autism, or we don't have a child with skin disorders, gut disorders, pulmonary disorders, childhood cancers. Everybody is really sick these days. And modern medicine is not the answer. We got to find out why people are getting sick. And that's the strategy.
Yeah. And so, I've had conversations with Sally about my birth defect, and she said, well, your mother's vitamin A stores were probably low. Can you tell us some good sources of vitamin A and what else we can do to have more of that good stuff in our bodies if we do want to have healthy kids without birth defects?
Yeah, well, I think that a woman before she gets pregnant and while she gets pregnant, again, we want to focus on the deficiencies and the excesses. So get rid of the excesses of the poison. And that could be anything from plastics, phthalates, parabens, PVCs, pesticides. And those are just the things that begin with the letter P. There's an infinite number of toxins. So minimizing those as much as possible. And then, yes, nourishing your body with the things it needs, including things like vitamin A. Now, the best source of vitamin A, like the best source of everything, is animal products. I don't make the rules. It's just Mother Nature. So to that end, I would tell women specifically, I would eat a lot of seafood. I'm a huge fan of seafood. Seafood is the healthiest food on the planet. And number two, which would be a distant number two, but that would be organs. It would be organs like bison, for example, bison liver, bison heart, right? If I want a child with a strong heart, why wouldn't I eat bison heart? And those things, both of those, the seafood category, the animal category, and of course, I'm always talking about ethically raised, free-range pasture, regenerative animals. I never eat anything else except for those. So the seafood, the organs, the meats, and then pasture-raised eggs, raw dairy, those are always going to be your ultimate strategies, not only for vitamin A, but every other vitamin, mineral, protein, and fat.
Yeah. And so I think a lot of our listeners are familiar with what you're saying because they love the work of Weston Price. And so it's really exciting to hear you reinforce it as a cardiologist. But in terms of avoiding the toxins, the parabens, the phthalates, the pesticides, how can we get those out of our lives?
Well, it's a process, like everything's a process. And let me just say this too, like in 2005, when I met the woman who would become my wife, and she opened up my eyes to natural health and wellness and pulled me out of the medical matrix. One of the first books that I read that put me on this journey was Nutrition and Physical Degeneration. And I read that thing like cover to cover, and I was just blown away because in medical school, we never learned any of that stuff. We never learned anything about nutrition, let alone the right stuff. And it was just, it's such a brilliant piece, that something that every medical student should be forced to read, undoubtedly. But yeah, I mean, really, what we want to do is, just focus on those kind of foods, those kind of lifestyle. That's going to lead to the ultimate in health and wellness, for all of us.
I agree. Like going back to a more natural lifestyle. Some of the things that we're talking about are things that have come into the modern lifestyle. We're like, oh, let's make farming easier. Let's spray everything with pesticides. And then those toxins, that residue ends up on the food that we ingest. And if it kills the bugs, what's it doing to us? We're thinking, oh, we like this nice foamy shampoo, but it has chemicals in it that are seeping into our epidermis and into our bloodstream and are negatively impacting us. If we went back to that lifestyle of those indigenous people groups that Dr. Price studied, we'd be much better off.
Yeah, definitely, to avoid all those things, it is a process, but it's doable. So one thing, starting with organic food. So getting the pesticides, the artificial flavors, artificial colors, artificial sweeteners, getting that out of our food supply. There's a lot of debate in the food world, right? Should we go vegan, vegetarian, paleo, keto, carnivore, all those different things? But we all agree that we should go organic. So get the poison out of our food. And then not so much, yes, we should avoid the bad stuff, undoubtedly, but let's focus more so on eating the good stuff. The fermented foods, of course, that Dr. Price, and Sally and Wise Traditions, all talk about. So, all those things are all critical. And then you talk about the pesticides, how they destroy the gut microbiome. The gut microbiome is really the window to the health world, undoubtedly. And when you consume these pesticides, kill and damage our gut microbiome, just from the pesticides, not talking about antibiotics in the food, antibiotics that they swallow. All these things damage the gut microbiome. Mold mycotoxins are antibiotics that destroy the gut microbiome. So all these things destroy the gut microbiome. They lead to intestinal hyperpermeability, often known as leaky gut. And then they lead to inflammation, oxidative stress, and ultimately to disease. So,
oh my gosh. So you're right. If we can focus on the good stuff that we want more of in our lives, then we will crowd out the bad stuff possibly and be protecting ourselves even just by making that one switch.
I'm not a fan of the 80-20 rule where, again, we should, do the right things 80%, but 20% digress. I don't think that's a good strategy. I don't think that's good for the environment. I don't think it's good for us personally. So let's not do that. But, can we have, raw honey as a sweetener more often than we'd like, and indulge in fruit and some of these other things, a healthy diet, healthy lifestyle? I think we can. But the more we avoid these environmental toxins that damage the gut microbiome, leading to leaky gut, this is all in the medical literature. the better off our health is going to be. But I will take this opportunity to mention mold mycotoxins. People live in water damaged buildings. The shower, sink, toilet, attic, humidity, HVAC systems, leaky roof or whatever it may be. This can ultimately leads to the production of mold mycotoxins, bacterial damage. All these damage the gut microbiome would be one way that they impact disease. So yes, we can combat that with the foods that we all know already, but even still, we got to get out of those toxic environments. They're highly problematic.
Yeah, I'll never forget years ago, my friends had a 7-year-old boy who just was having issue after issue. They couldn't figure out what was going on with him. And it turns out they had a tremendous mold problem in their attic. And so once they were able to remediate that, I think they just moved altogether. His symptoms cleared up. I think he was struggling with asthma and other issues. So you're right, it's damaging on a lot of levels. But I need to know, are mycotoxins found in our food too?
Yeah, mycotoxins definitely are. And I think, in general, right, the people that we're talking to right now, you guys, follow Weston A. Price, you follow Sally, you follow Wise Traditions, you listen to the podcast, all these things, you're fermenting your sourdough bread, you're doing all these different things. And that's all great, because if you weren't doing that, you'd really, really be sick, or ultimately worse than sick, right? You'd be dead. But if we look at how the mold impacts our health, if you look at what it does, not only from the environment, which I think is the much more sinister one, but also mold in the food. And that could be moldy grain, that could be, dried fruits. It could be anything that has been, preserved. And there can be some problems with that. I'm not overly concerned about mold overtly in food, although the animal data shows that if you feed animals mold contaminated grain, they're going to get sick. So we're going to follow that same line of thinking. But to your point about that other person who you knew, I hear thousands of stories. I've been a medical expert in cases of mold in homes, and these mold that grows on the building materials is very detrimental. And actually, it's in the Bible. It's in the Hebrew Bible. It's written by Moses in the book of Leviticus 3,500 years ago. He's talking about what to do if your home has mold, how to cleanse it, how to purify it. And if you can't, ultimately, like you said, you tear down the home or you move out. And I think it is even more of a problem today, because now you've got the mold plus all the other environmental toxins. So just take, for example, mold plus all the electromagnetic field energy, the man-made that we're exposed to, cell phone radiation, Wi-Fi routers, cell phone towers, satellites in space, radio waves, TV waves, on and on and on. And it just creates the perfect storm and helps to explain why so many people are sick.
Absolutely. So I want to talk to you now about a couple of cases of some friends of mine who, they're both women, let's say in their 40s, who both have had quadruple bypasses. And I want to ask you, they seem to eat a good diet. Like, what the heck is happening? What would you attribute that cardiac issue to?
Well, whenever someone tells me about any situation, whether it's somebody with a VSD like yourself, or it's somebody who had coronary disease requiring bypass surgery in their 40s, or maybe it's something like rheumatoid arthritis or lupus or cancer, these thousands of diagnoses in the medical textbooks that I graduated from, I always view it through what I call the lens of the 100-year heart method. And the 100-year heart method is about eat well, live well, think well, test, don't guess, evidence-based supplements, biohacking strategies. So when I hear about, for example, the women with coronary artery disease and bypass surgery, let's look at the eat well. And we talked about that. Everybody on this channel knows about the eat well side of the story. And that is the ultimate way to eat. There really should be no debate at all about what's going on. It's just, Weston A. Price, he saw what the ancestors did. How about if you take a look at these TV shows today, Alone, Naked and Afraid, Survivor, they are hunter-gatherers. And we have to be hunter-gatherers, and we can take some of the principles and have these fermented, foods and have these nourishing traditions of that food. And I believe that all to be the answer. There's debate. Let's not debate organic. But aside from the food, what about these other things that undoubtedly Weston A. Price saw? These people were going to sleep with the sun down. So when it got dark, they were going to bed. They weren't staying up until 11:30 at night, watching television on their phone. They weren't doing that. So they go to sleep as soon as it got dark. They woke up before the sunrise. They watched the sunrise, watched the sunset, And they spent the day in the sun with their solar panel exposed. So Weston A. Price saw that. It's in the TV shows of what's going on. So when you tell me about your 40-year-old friends with disease, I would say, are they doing that? Yeah, they got the food part, but what about the lifestyle? So sleep, sunshine, physical activity and movement, holistic dentistry, taking care of their teeth, being under the care of a chiropractor to get adjusted, which is absolutely paramount. But then inside of that lifestyle, you got this mega category of toxins. Let me tell you one recent study. They looked at people who underwent a procedure called a carotid endarterectomy. So they looked at the plaque that they removed from people's necks and their carotid arteries when they went for surgery. They broke it down into two groups. One group had evidence of microplastics, plastic under a microscope that they could physically see. 1/3 of the people did not have plastic. Surprisingly, in this society, they were able to find 1/3 of the people did not have plastic. But here's the kicker. The group with the plastic had triple the risk of heart attack, stroke, and dying over a 3-year period. So that makes plastic a bigger risk factor than smoking, drinking, high blood pressure, diabetes, obesity combined. So this toxin category is huge. And I think it really stands to show why these younger people are having, our genetics haven't changed. A disease like this was unknown in 40-year-old men and women 100 years ago. It was unknown at the time of Weston A. Price, totally unknown. But it's here today, not because of genetic changes, obviously, but it's changes in that lifestyle. And then ultimately, let me say one more thing here as far as our eat well, live well, think well. Stress is more prevalent now than ever. Chronic stress is more prevalent now than ever. The rat race that everybody is in. And not only that, the stress that is fed to us by the media, including over the last 4 years about fear, worry, anxiety, depression, post-traumatic stress disorder, childhood emotional traumas. These are things that have to be addressed. So your friends were not deficient in statin drugs or any other pharmaceuticals, and they weren't deficient in bypass surgeries. They were deficient in the eat well, live well, think well.
Yeah, it's interesting. One of the women in particular, I think, has a challenging marriage, a challenging relationship. So that might have contributed to that chronic stress you're talking about. It's not always just something that we see on the news or a worry in our head. It could be a relationship that is just out of alignment. And as a cardiologist, would you say that that kind of constant stress affects our heart health?
Not only would I say that, but I say that because it's in the medical literature. If people are in bad relationships, that is linked to an increased risk of cardiovascular disease, heart attack, stroke, and dying, and cancer and whatnot. I always tell people, I guess quite simply, find your happy. Find your happy is going to be the key. And now that could be through extracting yourself from bad relationships. If you can't fix the relationship, get rid of it. Sounds easier said than done, but I don't make the rules. It just is the way that it is. If you're not happy with your job, if you're not happy where you live, listen, I was a very, very, very successful cardiologist in the biggest group in the state of Arizona, but I wasn't happy because I wasn't doing the right thing. So I quit and started my own practice, at Natural Heart Doctor. So if I can make these changes, and sometimes, listen, I don't have to tell you, you've been around for a few years. Sometimes you grow apart from people, and this could be in a marriage, clearly if I had found this newfound religion of health and wellness like I did when I was 25 and I was in a relationship with someone who didn't believe in that and they weren't changing, I don't know how I could exist with that person, but you got to find your happy. It's very important to your survival. It really is.
I feel like you have an understanding that I have seldom heard, Jack, from specialists. So you're a cardiologist, but you get that it's not just a heart patient that you're seeing a whole person, and you want to take in their whole situation because you know that it matters.
Well, let's take, you, for example, or your friends, with the bypass surgery. So medicine can fix your ventricular septal defect. Surgery can't. And surgery can bypass those arteries. But if we don't go after the root cause, something else is going to happen. Another example, a common condition that I see is the irregular heart rhythm called atrial fibrillation. And atrial fibrillation A cardiologist can, burn holes in the heart and do what's a procedure called an ablation. But people with atrial fibrillation, they also have an increased risk of cancer and an increased risk of dementia. It's not that AFib causes cancer or dementia. It's whatever causes AFib also causes dementia and also causes cancer. So you can burn out the AFib. Heck, you can even replace the heart totally and get an artificial heart. But you still have the cancer risk. And if you don't go after root cause, you're going to be sick from something. This Band-Aid approach is not a long-term survival strategy. Men live until their mid-70s in the United States. Women live until their late 70s. That's not good enough. I'm 53. I want to be around a long time. My father died at the age of 63 as a cardiologist, died at 63 of a Parkinson's-like illness. The Mayo Clinic has no idea why my father is sick and dying. They have no treatment. And simultaneously and serendipitously, God put this woman in front of me, who was a 29-year-old chiropractor at the time. And she tells me exactly why my father is sick and dying. And I listened. And of course, I would marry her and have 4 children and the whole thing. But most medical doctors aren't going to listen to that. We're so brainwashed into the medical matrix. And it's sad, it's unfortunate, but by me sharing this message as often as possible, hopefully we can continue with the change and ultimately have the freedom to have these conversations, the freedom to speak our truth, and also, the freedom to question everything. I think these things are really critical in this 21st century world.
Coming up, Jack tells us exactly what that young chiropractor said and what they were convinced caused his father's health issues.
You're listening to the Wise Traditions podcast from the Weston A. Price Foundation. We pause now to recognize our sponsors.
Paleo Valley. If you avoid meat for environmental reasons, you are going to love Paleo Valley's grass-fed and finished beef sticks. Every time you enjoy one of these beef sticks, you can feel confident knowing that you're doing your part to end inhumane factory farms that negatively impact the environment. Instead, the beef from these Paleo Valley beef sticks comes from small farms, American-owned farms in the United States that practice rotational grazing, where farmers rotate the pastures in which the cows graze so that they aren't feeding in the same spot over and over again, depleting the soil, right? That means these cows are grass-fed, pasture-raised, and are part of regenerative agriculture and initiatives that improve the health of the soil and the nutrient density of the animal and help us as well. And did you know, by the way, that there are regulatory issues that allow companies to claim grass-fed as long as the cow was fed grass at some point in its life? And they can also put American-made on the label if the beef is packaged in the United States. Well, Paleo Valley can literally claim and legitimately claim that their cows are 100% grass-fed and grass-finished, raised on American soil. And that their true grass-fed beef, by the way, contains more calcium, magnesium, potassium, zinc, phosphorus, beta-carotene, and iron than grain-fed beef. So head over to paleovalley.com/wise to get 15% off your first order. Again, that's paleovalley.com/wise to get 15% off your first order. And the new biology clinic. Modern healthcare systems are failing us. Honestly, you know as well as I do, there are months-long waits for appointments. And then you sometimes only get 10 minutes with the doctor, who quickly makes a generic diagnosis, resulting in medication dependency, invasive treatment options, and unpleasant or harmful side effects. And there's never a real cure in sight. If this sounds all too familiar, consider a different approach with the new biology clinic. Founded by Dr. Tom Cowan, a respected alternative medicine doctor, author, and speaker, Dr. Cowan's holistic perspective on health and well-being make this clinic really unique. He understands the true nature of health and disease, and so he's put his stamp on the new biology clinic. It's not about quick fixes. The wellness specialist takes time to understand your unique story, recognizing that illnesses have many various causes and that you deserve a personalized healing experience. Clinic members enjoy a flat monthly fee that includes a range of valuable services like virtual health consults as needed, wellness specialist-led live streams on diverse health topics, access to a members-only resource library, and much more. There are also multiple live group sessions every month, and these sessions cover everything from fitness to breathing integration, biofield tuning, guided meditation, EFT tapping, and more. So, there are also levels and options for you as you come on board for individuals, small and large families, pet health and enrichment only, and even one-time health consults, where you don't even need a membership commitment. And unlike traditional healthcare systems that thrive on frequent visits, prescriptions, and that sort of thing, the New Biology Clinic's motivation is to find the root cause of illness and support your personal healing journey so that you stay healthy. I love it. So visit newbiologyclinic.com to learn more, or reach out to their friendly care team via phone or email. And make sure to use the code WISETRADITIONS in all caps to get $100 off your membership activation fee. Or you can use the code WAPF to get your first month free on an enrichment services only plan. Again, the codes have to be in all caps. So to review, that's the newbiologyclinic.com to learn more about what they have to offer, or reach out to their friendly care team via phone or email and use the code WISETRADITIONS in all caps to get $100 off your membership activation fee. Or use the code WAPF to get your first month free on an enrichment-only membership plan. Your journey to genuine healing begins here. This is Hilda Labrada Gore, and you're listening to Wise Traditions.
Well, of course, I have to ask you, Jack, what did she say to you about why your father was sick and dying?
So it was very quick in our relationship. Really, it was almost like the first date. And she says it quite simply: your profession is worthless. Your profession is killing people. Your profession is not saving anybody. Your profession is not going after root cause. The pharmaceuticals kill people. The surgeries kill people. And I think, again, as I look back on that, I would say, well, that's mostly true. And I think she's making a big generalization, obviously. And I do believe, obviously, the procedure for your VSD was helpful. And if your friends need to bypass surgery, it's helpful. But the point, really being is that she said, your father eats like crap. Your father lives like crap, meaning he doesn't get sleep and sunshine and lives in the toxins. And she said, if you don't change, Jack, you're going to be sick. I'm following exactly in his footsteps as a cardiologist. So, and I go to the Mayo Clinic, and the Mayo Clinic's like, we don't really know. It's not really genetic related. We don't have any family history links to that, but yeah, we don't know. And then again, the 29-year-old chiropractor who has the chiropractic philosophy of like, hey, let's talk about food. Let's talk about lifestyle. Let's talk about chiropractic to improve the neurologic status of the body. That's what chiropractic is. It's not bone on nerve, type pain that people think that it is. It's about using the chiropractic adjustment as a method to increase neuroplasticity, cause these neurologic changes that could have helped my father, of course, and can help anybody in that situation.
Wow. Well, going back to what you were saying earlier about getting more of the good stuff in and less of the bad stuff, I want to address what you were saying about how having plastic in the carotid artery was a marker for a stroke or other illnesses or a death in a few years. How were those people getting those plastics in? Because we want to avoid those.
Yeah, so plastic getting in, it's just ubiquitous in society. The air we breathe is going to contain things like bisphenol A and phthalates. And those are things actually you can actually test yourself for. They're testable in your urine, so you can determine what your burden is. The plastic, of course, plastic water bottles would be a big offender. Plastic, water containers, personal care products that are in plastic. Plastic and water lines are a big. How about plastic clothing? I was doing an interview yesterday, and the host was wearing an Under Armour, like workout, shirt, and all that stuff, that nylon, that polyester. That's all. You mentioned skin earlier on in this conversation. That's all just going right in through your skin. So it's going to be impossible to totally excommunicate plastic from our lives, but the more so we do, the better. And then this is also where can we give our body the nutrients to protect us the best that it can? So can we give our body the nutrients from the sleep and the sunshine, the physical activity that we talked about? Can we give our body the food-based nutrients? So when we're eating these animal products, including the organs, and we're eating the seafood, that's going to be a protective strategy. When we eat fermented foods that are living foods, including raw dairy, that's going to have these living, bacteria in there. Those living bacteria nourish our gut microbiome to actually help to metabolize and break down bisphenol A and other components. We're learning more about this, and we're learning maybe about what individual probiotics, maybe from a supplement standpoint, could help in that arena. But I think we're going to have a hard time outsmarting Mother Nature if we use these fermented foods and we use the raw dairy products, the kefirs, the yogurts, the raw milk, the raw cheeses that are living foods. That's going to help our gut microbiome to, metabolize all these things.
Yeah, it's like the tools are actually delicious and right in front of us. The sunshine you mentioned earlier, movement, we were made to move. It's such a simple reality, but in our stressful day-to-day lives, I think we sometimes put our self-care on the back burner and then we pay the price with poor health.
You need to take care of yourself more so than ever. You need to focus on these things. Yeah, we're so time spent, whether it's work, other, activities that consume our time, but it really has to be focusing on your health first. It's kind of like when the oxygen mask, in theory, drops in when you're on a plane, and then the instructions are always like, take care of yourself first, put the mask on yourself first before, your children and worrying about others. Because if we don't maintain self-care, if we don't take care of ourselves, if I don't take care of myself, Jack Wolfson, well, how can I help my wife? How can I help my children? How can I help animals? How can I help people, on the, around the world like this? So you do have to practice that sense of self-care. Weston A. Price, in that time frame, when you go out into the wilderness, like he did, those people didn't have to do that because they lived it. They just lived it 24/7, and so did everyone in their community. But in a 21st century world, we need to practice these things.
And I know you understand this, Jack, because you've been in practice for a while and your own life is busy. But what would you say to the person who's like, okay, it's great for him to say that. I do eat well, but I don't have time to exercise. I'm working practically 24/7. And then when I get home, there are demands in the family. And how can I work out or even get adequate sleep when I'm being stretched so thin?
It's not easy. The world is against us. The world is against us. I mean, there was a few years ago, my oldest son, he was playing on a soccer team, and the game started at 8:15 on a Saturday night, and it was in Arizona, so the temperature was warm, but it's dark out. It starts at 8:15, and I let my son play, but I let it be known, like, this is not, right, that the children should not be doing that. Nobody else cares. I mean, that went totally on deaf ears, but, we just need to, get people to really make small changes and really try and focus on doing the best that you can. I mean, there's so many different things that we can look at, regarding that, how to make, more time, how to be better, with our time, but either make time for being healthy now, or you better make time for sickness later. And you will be sick later if you don't follow the wisdom of God, Mother Nature. There's just no other way around it.
Jack, can you tell us a story of a patient or a client that you've worked with that you saw wasn't eating well, living well, or thinking well, and how some of these shifts help them recover their health?
Yeah, most certainly. I've seen tens of thousands of patients in my career, and of course, spoke with hundreds of thousands online, if not millions overall over time. And I'll tell you a cardiac example, and this is another example of just kind of this strange diagnosis. So a guy comes in, he's got this diagnosis of sarcoidosis, which is an inflammatory condition. It's kind of more common in the medical world, but again, the Mayo Clinic says we've got no reason for this. He's under the care of the doctors at Mayo and UCLA. He's got cardiac issues. He's got sarcoidosis. And I ran all my testing on him and found out he had high levels of mold mycotoxins. Now I go onto the internet and I find a reference from 2011 that showed mold mycotoxins in a home contributing to sarcoidosis. So this is something, again, that now we work on remediating the home, which he was able to do, getting him on, the Eat Well, Live Well, Think Well, Test, Don't Guess, evidence-based supplements. And now the guy's heart function is normal. We reduced him from 7 pharmaceuticals to 2, and the guy feels great. Heart function's improved. So I can go on and on, with cases, really like this. And, again, I've been around a long time and I've seen a lot of people, but when you give the body what it needs and take away what it doesn't, it's going to heal. It's going to heal. Now, there is a breaking point. Again, I think there is some point of no return, maybe from people with severe sickness, like stage 4 cancers and things like that, but they should always be given a trial. Like you said initially, like medicine should be the last thing, which is true. Like if someone has a stage 4 cancer diagnosis or an autoimmune diagnosis, let's do something about this. And it really does require all those things of the eat well, the live well, the think well. And then as you look at, kind of like what time you go to bed, if you go to sleep at 11:30, go to try and make it a little bit earlier. If you're outside a little bit, try and make it outside, a lot more. Remember back in the day, people would take smoke breaks from work. Well, instead of a smoke break, you take a sunshine break. You go out in the natural light, you go walk around, you put on your warm clothes, your winter hat, whatever you need to do at that time of year, and do it that way. And that's going to be a great survival strategy. But I do understand it's not easy. Sometimes your spouse is against you. Your kids have these things, going on. All we can do is try our best. And I think also too, listen, you're a mother with children, and maybe God willing, be, a grandmother someday, and I'll be a grandfather someday. This is where you're the matriarch or the patriarch of the family, and you're really leading by example. You're talking the talk, but you're walking the walk as well. And that approach, sometimes, you can try and hammer people over the head with this information, but sometimes you just live it to lead it, and lead by example.
Absolutely. I love it. I always say more is caught than taught. So you can tell people all the things you want, but they sometimes need to see it, especially the people closest to you, which makes me think about, Jack, when you first had that conversation with your wife and she was kind of waking you up to the fact that your profession wasn't doing what it needed to do. What were some of the first changes you made as you tried to adopt this eat well, live well, think well lifestyle?
Yeah, the first thing I certainly did, and like I said, there were so many books that were influential, but certainly none more than Dr. Price. Really, it started with food at that point for me, really just understanding the importance of organic eating, of the seafood, of the free-range grass-fed meats. But you're talking to a guy like, I grew up in Chicago, deep dish pizza, Italian beef sandwiches, hot dogs. I talk about this in my book, where I was drinking Diet Mountain Dew. I was drinking probably 2 liters of Diet Mountain Dew on a daily basis. So that, I would get pages from the nurses, the hospital, and they're like, "Oh, Dr. Wolfson, you left your Diet Mountain Dew bottle down here." I'm like, "Oh, okay, I'll come down and get it." So really just getting rid of all the artificial crap, the aspartame, acesulfame, artificial colors. I think that made a huge difference. A lot of times though, Hilda, people ask me, do you feel better now that you live this way? For me personally, because a lot of people do, they feel much better when they change the way they eat, the way they live, and the way they think. Me personally, I felt good at 33, and I feel good at 53. For me, it was about prevention. It was about, I don't want to die like my father did. I have children ages 3 to 17. I want to be around a long time. And you said it, where you've got these people that have heart disease in their 40s, cancer in their 40s, brain disorders, movement disorders, Parkinson's, PSP like my father, autoimmune conditions, and they're young. We saw a Facebook post from a woman who I'm friends with who is in the health industry, and her child has struggled with Crohn's disease, an inflammatory bowel condition over the last couple of years. And you're like, hey, this is a person who, likely teaches her children and the children eat fairly well and live fairly well. But what's missing here? What's missing is taking it next level, eating all the right foods, eating all the, doing all the right lifestyle things. And then ultimately, is this child living in mold that suppresses the immune system, that damages the gut microbiome? And undoubtedly, again, children are not born to develop Crohn's disease. It's another man-made affliction.
So I think you've given us a good handle on what it looks like to eat well and to live well, the balance of the exercise and sleep and sunshine and all this. But I'm not sure I've wrapped my head around yet the think well. What advice do you have for applying that to our lives?
Yes. And whenever I speak to someone who's had a heart attack, they've had a stroke, I always try and get into the conversation of what was happening right before this. Was there some sudden stressful event? There's 2 medical diagnoses that the women should know about. One is called Takotsubo cardiomyopathy. That's broken heart syndrome. That is typically in the 40 to 60-year-old woman who has a stressful event at work, a stressful event at home, and then has a massive heart attack and subsequent congestive heart failure. There's another one called SCAD, spontaneous coronary artery dissection, where the blood vessel just essentially separates and shears, leading to a potentially massive heart attack. So we want to get people to understand that stress is a problem. So how do we deal with that? And I really kind of use different things in here. Spirituality is going to be a big factor. Finding whether it's religion or, again, some kind of greater purpose or entity is very important, certainly. And whether that be, Christianity, Judaism, any other, religious aspect, or just believing in the innate and some, creator of it all. The other would be, community. And I think that's what's great, obviously, about the community you guys have developed, like finding your tribe. And so many people are socially isolated. People who identify as socially isolated, it's a death sentence. Bad thing. And over the last 4 years, a lot of people feel socially isolated. So finding your tribe, finding your community, very important. Self-acceptance. For who we are, what we've done. And again, that's, our past is our past, the future is the future, having a better future, accepting us for what we've done. That sense of gratitude, being grateful for what we are, where we're at in the state of time is important. Safety, security. A lot of people don't feel safe in their home. They don't feel safe in their workspace. And that leads to a problem. So you need to find safety in your home and in your workspace. That's very important as well. So those are just kind of some of the tips and strategies in that think well category. And, that can, thinking well can include meditation. It can include breathing exercises, breath work. There are some biohacks, brain tap and other kind of technologies that can be useful there. But we really want to just open up people's understanding of that. And then also, listen, unpacking childhood trauma. Like there are experts in that field of childhood trauma. I'm not an expert in treating childhood trauma, but I am an expert in understanding that childhood trauma is problematic, and people, whatever modality they would use to work through those issues, I think will be beneficial. And then again, PTSD. How about health challenges that are traumatic in and of itself? If I'm a 35-year-old guy who had a massive heart attack and I'm alive, like that's got to play on the brain here. That's got to cause some major underlying, stress and things like that. So
yeah. Well, these are great. I feel like we will put a link in the show description, obviously, so people can find your website, find your book, find more resources for a better understanding on how to eat well, live well, and think well. I think this is fabulous. And I wish we could keep going, but we have to wrap up now. I want to ask you here at the end, Jack, if the listener could just do one thing, if they could just do one thing to take a step in the right direction for improved health, what would you recommend that they do?
Oh, that's a tough one. I get asked that, pretty often. I would say, because everyone here knows about the food, so I'm going to say, get outside more often. The more time you spend outside, the longer you will live.
Oh my gosh, a powerful statement to end on. It has been a pleasure, Jack. On behalf of the Weston A. Price Foundation, thank you.
Thank you.
Our guest today was Dr. Jack Wolfson. Check out his website, naturalheartdoctor.com, to learn more. And I am Hilda Labrador, the host and producer of this podcast on behalf of the Weston A. Price Foundation. You can find me at holistichilda.com. And for the transcript for this episode, visit our website, westonaprice.org, and click on the podcast page. And now for a recent podcast review from Apple Podcasts. Mauricia James said, Sally Fallon Morell helped me get my period back. She says this story: years ago, I tried being vegan and plant-based. I was eating less and less meat. Luckily, I never fully stopped because my husband refused. But nevertheless, we were eating meat less than once a week, and definitely no dairy or butter. My period started coming later and later, and I couldn't figure out why. I would take multiple pregnancy tests, and they were all negative. Once it was so crazy erratic that I bled twice, 2 weeks apart, and I freaked out, and I even went to urgent care. Then in 2018, I found the Wise Traditions podcast, and I listened to an episode where Sally talked about the importance of animal fats and butter fat for reproductive health. I also found out that we needed lots of iodine as well. That same day, I went to the store and got grass-fed butter and wild-caught fish and ate them. After eating fish, meat, eggs, and butter every day for every meal, my period normalized within 2 months. I will forever be thankful to the Weston A. Price Foundation. As I am writing this, I am eating a traditional Turkish soup made from tripe and cow's stomach. Oh my gosh, Mauricia, this is a wonderful story. I am so glad that the podcast and the foundation has made a big difference for you. It has a tendency to do that. Thank you so much for your review. And if you've had an experience like hers, or you want to tell your own story, please go to Apple Podcasts, click on ratings and reviews, give us a bunch of stars, and tell the world why they should listen. Or tell them how the Weston A. Price Foundation has changed your life. And thank you so much for listening, my friend. Stay well, and remember to keep your feet on the ground and your face to the sun.
On behalf of the Weston A. Price Foundation, thanks for listening. We have many free resources to support you on your health journey. Visit westonaprice.org to find podcasts, articles, videos, and more. You can also find a local chapter near you for help in finding sources of great food. We invite you to support the Foundation's mission of education, research, and activism by becoming a member. Thanks again, and take care. Wise Traditions is a project of the Weston A. Price Foundation for wise traditions in food, farming, and the healing arts. The content on this podcast is provided for informational purposes only and is not intended to substitute for the advice provided by your doctor or other healthcare professional. It is not intended to be, nor does it constitute healthcare or medical advice.